Welcome to We Question and Learn. This is Tom Pies. We're celebrating our 20th year on the air here at WQLN FM 91.3, WQLN NPR. And a very special guest on with me today in preparation for a very special day. I'm honored to have Karen Bilowith, President and CEO of the Erie Community Foundation. And Karen, you came into that position, I think, October of 2021. Am I right?
That's right. Yes, I've been here just under 2 years.
And time flies. So you've lived through one Erie Gives day. Is this your second one then?
This is the second one. I was amazed and surprised at the experience on Erie Gives Day. So I'm looking forward to the second.
Okay, so let's educate our listeners today for folks that are tuning in online or out of town. Let's start with the Erie Community Foundation, which has been in Northwest Pennsylvania, Erie, Pennsylvania. I've lost track. How many years has the Erie Community Foundation been in existence?
We are coming up on our 90th anniversary.
That's amazing. That's amazing. That's great. Do you care to offer a little history, how it was founded and how it came to be for this community?
I will. The Erie Community Foundation, like community foundations across the country, was founded by a group of local, committed philanthropists who wanted to do something to improve the local community. So I'm going to turn it over actually to Erin Fessler, who is also online, and she can give you kind of a brief synopsis of our history, and then I'd love to come back and tell you how we've updated our mission this year.
That would be great.
Thanks, Karen.
Erin, you and I have known each other for years. We could almost say decades, but we won't do that. So I know that you have a good handle on the Erie Community Foundation. How many years have you been there?
I'm coming up on 20.
Oh, okay.
Next year will be 20, but
okay.
I know. I started out part-time, so maybe that helps
That's
a little
exactly
bit.
it. We all started when we were 12 or 13 years old. That's how we calculate that.
Yeah. There you go. That's right, Tom. So the Erie Community Foundation, as Karen mentioned, is 88 years old, so in a couple of years will be 90. It was founded in 1935 by Elijah Mack. Gave the foundation its first dollars, and he was the owner or part owner of the Boston store. And so when he left his endowment in the early 70s, that was the beginning of the Erie Community Foundation. 1935 is when he was around, gave money, and then in the 70s is when it all became a community foundation. So it went from a fund to a community foundation. And then Ed Dahl ran the community foundation. He was our first volunteer president for numerous years. And then eventually in 1990, Mike Batchelor was hired as the first executive, and then he was at the helm for a long time. And then Karen joined us almost 2 years ago now. So the Erie Community Foundation has changed tremendously, at least in my time, from just being a grant maker to really being a change maker, and one institution in our community that's here for a long time. And our purpose is really to uplift our community and be there for all the needs that have changed over the years. So when Elijah Mack gave his first dollar, there were no such thing as computers. There were no such thing as cell towers. And now we give grants like that to Make-A-Wish or to a local nonprofit that needs an upgrade in their electronics and their Wi-Fi system. So times have changed since 1935, and the Erie Community Foundation has been there through it all.
For the sake of education, Karen or Erin, where physically is the headquarters of the Erie Community Foundation?
So we're located at the corner of 6th and Walnut, 459 West 6th Street, and our campus has really grown. It's really a beautiful space. We have a big acorn out in front, and the reason for that is an acorn symbolizes an endowment. So what you plant today, 100 years from now, just like it will be growing, just like what was planted in 1935, we still have the original dollars of Elijah Mack, but we've grown his dollars over the years and given it away. Behind us is the Susan Hurt Hagen Center for Transformational Philanthropy, and the nonprofit partnership is in that building. And we've just acquired the Lowry House, where Karen's office is, as well as our philanthropic services team. And last year we went through a strategic planning process, and Karen can share with you what came out of that process and how we've changed even more just within the last few years.
Well, let's go back to the younger member of this team, Karen Bilowith, the president and CEO. This has been an interesting 2 years. You've gone through one Erie Gives Day, and another one is coming up. Would you care to let us know when it is?
Erie Gives is going to be on Tuesday, August 8th, and as Erin likes to say, it's 8-8 from 8 a.m. until 8 p.m.
Fantastic. How will it work this year? Is it the same as is it 6 or 7 years? Do I have the count right?
No.
No?
This will be our 13th year.
Oh,
so
well,
as
there
I
we
was
go.
just saying earlier today, time flies, especially when you're making such a tremendous impact in the community.
Right.
So this is the 13th year, and we have changed in a couple of significant ways for this year. So one of the things that we've been thinking about over the past year is how we can, since this is such a big success for the community, and we know that the nonprofit organizations that participate rely on the money that's raised on Erie Gives Day to help sustain their annual budgets, we wanted to create sustainability for Erie Gives. So we are now moving to a platform for giving through an organization called GiveGab. So that is all they do at GiveGab is facilitate and provide the underlying infrastructure for giving days across the country.
Mm-hmm.
So by working through GiveGab with a new platform, we can enhance the security of the online giving. We have a lot more functionality, and just one example of that is that the individual nonprofits are able to put more photos, even videos on their individual pages. So we think it's a way for our nonprofit organizations to be able to tell their story better. Erin and her team have done a really good job over the past few months helping the nonprofits as they register understand that if they use this tool to its fullest, they may see more significant results this year.
That's fantastic. What a great idea. So over the last 13 years, this will be the first somewhat better technical year for you. Am I correct?
We've had a strong platform to date. I don't want to say that, but yes, every year it just gets more and more complex as technology changes.
Yes.
And last year we had a little glitch right at the end where our system went down and came back up a few minutes later. So we don't need that stress. So we're really excited for the new platform.
I remember when
Tom, that really speaks.
Yeah. Go ahead.
Oh, sorry, Tom. I was just going to say that speaks to how Erie Gives has really grown. The first year in 2011, we had 213 nonprofits signed up, and we raised $776,000. And now when you look at last year, we had 468 nonprofits and raised $8.1 million in the same 12-hour period. So technology has changed. The amount of giving has changed. I mean, the first year we did it, I think we operated off of one server, and last year we were at 8 servers.
Wow.
So GiveGab, this is all they do is giving days. And so they have even the latest and greatest technology, and they've been a tremendous support in helping us grow Erie Gives again for this year.
Karen, how did it turn out last year for folks who are unaware of how this worked?
Last year, we had another record-breaking year. We raised over $8 million, and as Erin said, we had over 400 nonprofits participating. So I think it exceeded expectations, and as I said, it was my first time, and I really didn't understand that throughout the day, throughout the 12 hours, the phone rings constantly. People are have been sending checks in, and people are online making online gifts, throughout the whole time. So it's quite an active day, and it's amazing to think in our community we had over 11,000 different donors contribute on that one day.
That's absolutely amazing. Now, I feel some sympathy because public broadcasting has been operating like this for over 50 years. But on the other hand, because of the number of donors and the number of nonprofits that are involved with you, that number just becomes exasperating to some degree. Can you talk about how a nonprofit becomes eligible for a gift on Erie Gives Day?
So in order to be eligible, the organization first has to be a registered nonprofit charitable organization, the IRS. That's the first thing that we check. And then they either need to be a member of the nonprofit partnership or have an endowment fund at the community foundation. And we see this as a way that nonprofits can strengthen their relationship with their donors and maybe gather new donors. So by having those criteria in place, they can rely on the training and opportunities provided by the nonprofit partnership, for example, to become stronger organizations.
So now we have two things to talk about. One, the Erie Community Foundation. And for folks that do not know how this works, I've heard people misunderstand how it's set up structurally. It is a foundation, correct?
So when Erin talked about how we were founded, it's interesting. The initial gift that became what is now the Erie Community Foundation was a gift that in today's world would be considered a private foundation. But over the years and through the work of Ed Dahl and many of our board trustees, what happened was we became a community foundation. And the distinction between a community foundation and a private foundation is that we have multiple donors. Our gifts come from literally hundreds of donors who are both living and through their estates. So our purpose is to honor the donor's intent, but also as a public charity, we have to benefit the public interest and the public trust. So it's different than trusts that are set up to benefit a specific entity or even serve the specific interest of a single donor.
So the volume of money inside the Erie Community Foundation, what is that up to?
At the end of our last audit, so the end of 2022, we were at about $360 million.
And I can remember
373 million.
I can remember it was $100 million when I first got involved. In due process here, you let folks know that I sat on the nonprofit partnership board for a good number of years, president for two. So I sort of know some of the workings of different aspects of that group as it affiliates with the Erie Community Foundation. But indeed, there are things involved with the Erie Community Foundation today that are all new just over the last batch of years. You have a lot of, if I could use the term, categories or departments. You probably have a better word for it. You have different projects and outcomes. How does this work? How do you manage all these different segments of the Erie Community Foundation?
Well, I'll simplify it for you a little bit. So as I said, this year our board went through a strategic planning process and updated our mission, which is to inspire, engage, and empower donors and communities across the region so that we can work toward our vision, which is a united, vibrant, and thriving region for all. So what that means is we traditionally and historically have worked with, as I said, hundreds of donors over time to raise the funds that became the community impact funds that we are now using to make grants and lead transformative initiatives in the community. So I think the difference in how we're looking at our work now is that we know the challenges and opportunities in our community are complex, and we alone can't solve them, nor can one nonprofit organization. So we're really working to build partnerships and coalitions across community, across issue areas, so that we can start to make true progress on community challenges and create new opportunities. So our work looks different in many ways. I think, what you're talking about is we are involved in multiple cross-sector initiatives like Infinite Erie, for example,
Yes.
which is intended to leverage resources to ensure equitable and inclusive economic and community development. So we look at the issues that we've always been interested in addressing, like education, health, workforce development, but we think about how do we help bring together all of those partners that have an interest and the ability to make an impact here and create and leverage resources so that we can see change over time.
And you manage this with different projects like the one you mentioned. Would you call it a project or is it a grouping? What's your definition of something as a project or an outcome?
So, for example, Infinite Erie is really, it's a collective impact initiative. And what a collective impact initiative is, it's a way to, again, bring together all of the partners to create shared goals for our region. And in this particular instance, the shared goals are all related to economic and community development, both in the city's core, but throughout our community. And those are focused on creating new businesses, on workforce development, neighborhood improvement, and identifying projects underneath all of those different priorities that we can bring additional resources to our community to see those projects to fruition. So that's I would call that an initiative. We also have our ongoing grant making, which is more traditional for the Community Foundation. And within that context, we are still giving grants in 3 categories: helping today, shaping tomorrow, and transformational grants. So we're trying to think about how we continue to support the nonprofits in the community that are doing great work, but are also at a higher level. How do we bring all of those different partners together so that we can create more impact across our community?
So you have different donors with donor-advised funds. Then you have donors that contribute, I think, to general funds. You probably have that or a different name for it. Have I covered all the bases, or there are other things that you get involved with?
So we have we have donor-advised funds, and that's when we work with donors, as you say. They can recommend distributions and grants to organizations that they support. Our community impact funds are the funds that donors have entrusted to us, oftentimes through their estate, to meet changing needs in our community. So those are our most flexible funds. But we also have scholarship funds. We work with many nonprofit organizations who set up agency endowment funds, so we can help them build their endowments and their source of sustainable revenue for the future.
I know the Erie Community Foundation is aptly named for the city of Erie, but I do believe you have other regional foundations that partner with you.
We do, and I'll turn it over to Erin so you can hear somebody else's voice for a minute.
Okay. Erin, tell us about the other community foundations, if you would.
Sure. So, Tom, we have community foundations in Northeast Corey, Union City, and Findlay Lake. And there's a board for each of those community foundations and they fall under the umbrella of the Erie Community Foundation. And so the people who serve those boards live in those communities, they know those communities, and they know what the needs are, probably greater than we do. And ironically, they are also part of Erie Gives. And with Erie Gives, we have a bonus buck pool of $450,000 that we will spread across all the participating nonprofits in Erie Gives this year on August 8th. But Corey, Northeast, and Union City, they also participate in the bonus bucks for their nonprofits. So Northeast adds an extra $30,000, Corey an extra $20,000, and Union City an extra $10,000. So if you're a nonprofit in one of those communities, not only are you eligible for the big $455,000 bonus buck pool, but there's also these other 3 bonus buck pools that your nonprofit could be eligible for.
So at the end of last year, could you give me the total raised on Erie Gives Day again from last year?
Sure. It was over $8.1 million. Exactly, it's $8,178,207 down to the penny.
I can't imagine collecting that much money. That's a lifetime for some individuals. It's a lifetime for different organizations. That's phenomenal. So philosophically, people get enthused about what the public broadcasting people calls a one-day pledge drive. This seems to generate more and more excitement every year.
Well, definitely.
It does.
We had 11,234 donors last year. And as Karen said at our press conference at the end of the day, which was a couple weeks later, when the day was over, what's almost more valuable than the dollars are extremely important because it meets immediate needs, but it's the number of donors who a nonprofit raises. It's friendship building or friend raising, I guess you could say. And this is the one day that the Erie Community Foundation does fundraising and helps the nonprofits have a new donor list at the end of the day. And that's their opportunity to showcase the good work that they do and build relationships with donors who might just heard about them through Erie Gives. I was talking to a donor yesterday. She lives in Long Island, and she already told me she has a $5,000 check coming. She pulled out the magazine from last year and looked at the list and told me who she's going to give to from her IRA. And then she said, and I see you have some new ones, because this year we have about 32 new ones registered. And she said, tell me about this one, tell me about that one. and she said she's going to log in on Erie Gives Day, August 8th, and make some credit card donations since she lives in Long Island. But she is sending us a check from her IRA, and she's just delightful. And so you ask, well, how does somebody from Long Island know about Erie Gives? Her sister used to live in Erie, and she was here one time over the past 13 years and learned about it and just thinks it's marvelous what we're doing in our community.
Karen Bilowith, let me direct this to you. Do you sit in the captain's chair in the main office and watch the computer screens tally up the results? Although this year it'll be a little different. I'm sure you're busy well before this day, promoting it, encouraging donors, educating folks who know nothing about it, about how it works. Was this year busier than before for you?
It is busier in a couple different ways. One is because we are initiating this new platform. Erin and her team and the team at NPP have been really doing a lot more outreach with the nonprofits so they understand how to set up their pages and how to make the most of it. I think, as Erin said, this is an opportunity to have really free advertising for your organization, so get the message out there, but also at the end of the day, you have a whole set of donors to your organization. You get that information through the platform, and you can use that as your list for sending out solicitations or information throughout the year. So it's really helping nonprofits build their capacity for fundraising. On the day of, it is very exciting in our offices, and this year we're actually at lunchtime having a parking lot party. We'll have a food truck here, and we'll invite some of the nonprofits and people to stop by to be part of the excitement. But we do have computer screens that we can see the running totals, and it's all hands on deck at the foundation, and some of our board members come in and answer phones, and everybody is answering phones, accepting checks, entering checks. It's very busy for months leading up to, as you say, but also on the day of. And for a couple weeks afterwards, our finance staff are busy getting the money counted, and we send out the checks within 2 weeks of the end of Erie Gives.
Is that right?
Yep.
Wow.
Mm-hmm.
So after 13 years, you have this down to an art.
I think our team here deserves so much thanks and kudos, because they really do have it down to an art, as you say.
Karen, let's take a step back and talk a little bit about the Erie Community Foundation. There is a board, and would you care to talk a little bit about the board and how it functions with an organization of this energy and financial strength? Are they long-term board members? How is it set up?
Yeah, well, we have a board of committed people who are all actively involved in and engaged in the community. And one of the hallmarks of community foundations is that since we are a local organization impacting place, our board reflects the community. So we have a board that is diverse in terms of their professions, their skill sets, and that's something our board has been really committed to, is really trying to enhance the composition of our board so that we are reflective of our community as it changes over time. Our board, like most nonprofit boards, we have board terms, so the trustees serve for up to 12 years, but it's up to 9 years, but it's three-year terms. So we have opportunities to keep the board changing, which I think is important. Mm-hmm. And as I said, this past year we went through a strategic planning process, which was really led by the board, because I think, and I give the board a lot of credit for being patient through that process, but they wanted to reflect on our accomplishments, our successes, but to stay relevant as our community changes. What are the things that we need to do? What priorities do we have to set? And they're active, engaged, and both at the strategic level, but also our board sits on different committees that help to review the grants that come before the Community Foundation, provide oversight over our financial operations, and do all of the things that boards do.
Well, I know you have Erin Fessler, who's I've known for years, highly talented and ambitious. Can you talk about her fellow employees at the foundation? How many people do you have working there now?
And thank you so much for asking that question, because it gives me the opportunity to again say we have a fantastic team here. Many of them, like Erin, are long tenured employees. So we have several that have been here for almost 20 years, another group that's been here for about 10 years, and then we have several new staff. So our team is growing. We're up to 17 employees. We just added a new database administrator because as we become more complex, we have to update our systems, and he's really helping to do that. But, our team is not only very skilled in the work that we do, but another thing that I'm really proud of is that we're all out and about in the community in different ways. So some of our team members serve on different boards or volunteer with different organizations. So they are the eyes and ears that help, just like our board being actively engaged in the community. Our team as a group really helps inform the work that we do.
I remember talking years back with Mike Batchelor, and that community foundations were not that common. In today's world, I believe there are many more. You have a good board. You have a good set of employees, very talented individuals. I know some. I wish I knew more. As you come off of the COVID era, do you feel things are improving for the nonprofits in our community?
That's such a good question. One of the things that we've noticed over the past maybe 6 months to a year, is that we're starting to see through the grant applications that come in, we're starting to see that organizations are getting back to their mission-related work and are less impacted by having to respond to the pandemic. And that could look different for all of the different organizations. Yet at the same time, we all recognize that the pandemic uncovered a lot of challenges that we have. So I think that the nonprofits are navigating in a new world, like we all are. And I think nonprofit organizations are innovative and flexible in a way that other organizations are not. So we're seeing a lot of strength coming out of it. And the other thing is that we're seeing an increased desire and focus on partnership and collaboration. I think we all understand that needs to happen, again, in order to address some of these more complex issues in our community.
I wish we had a couple more minutes to talk about the nonprofit partnership, but I'm going to assure you I will give them a call and obligate them to do a half-hour discussion on all the members of the nonprofit partnership, their
Great
outreach,
idea.
and how they partner with you and how you help them and they help you provide great things for people in need, organizations in need in our community. First of all, Erin Fessler, thank you for being online today. I really appreciate it. It's good to hear your voice after a long time. Thank you for being here.
Yes. Thank you, Tom, for the chance to tell your listeners about the Erie Community Foundation and about Erie Gives.
And this is my second interview with Karen. Thank you again. You were excellent as usual. Thank you for all the good information. And of course, if you could right now, if someone just wanted to email or give a call, where or how should they do that?
If they're interested to learn more about Erie Gives, they can go on eriegives.org. And if they want to learn more about the Erie Community Foundation, then eriecommunityfoundation.org.
Can't beat that. That's great. Thank you both for a wonderful half hour. It was very enjoyable speaking with you. And good luck on Erie Gives Day.
Thank you.
Welcome to We Question and Learn. This is Tom Pies. This program, we're celebrating the beginning of our 20th year on the air at WQLN FM 91.3, WQLN NPR. So I've been reaching back and trying to find some folks who have been around. And just about 20 years ago, a wonderful gentleman by the name of Dr. Barry Bittman would put on his headphones and sit in a very warm studio and record a program. It was the first nationally syndicated Integrative Medicine Weekly public radio program called Mind Body Matters. And I remember it like yesterday, Dr. Bittman. And I remember seeing you sit there diligently recording. It's good to hear your voice again.
Well, it's fabulous to hear yours. And I'll never forget how much I learned from that phenomenal show.
Well, if I could go back, one of the folks that you had on as a guest, and it really knocked me over a few years later. I think you were one of the first people, and correct me if I'm wrong, that interviewed Dr. Deepak Chopra. Am I close?
Yes, and I was surprised as well because we started out with the idea of getting some visionaries involved, and well into the syndication of the program, we had countless calls from some of the most fascinating authors, researchers, physicians, and mind-body experts in the world. So it was truly an amazing experience.
And you were on several major markets in the show, in my opinion, and in the opinion of many others, was an excellent program. 115 episodes. Do you still have those stashed away someplace?
Yes, I absolutely do. And what's interesting is that wherever I lecture or speak, someone pops up out of the audience and says, "Are you the guy that did Mind Body Matters years ago?"
Yes.
And that just warms my heart.
Is that running in any way, shape, or form in the 21st century here?
I don't think so.
Oh, that's too bad. Those were timeless. Many of those programs were timeless.
We had a lot of fun in the day.
It was good. And today, let's move forward. I have your resume here, and it will take most of this half hour to read it. But let's move on to your main activity, if indeed we can, the Institute for Innovative Healthcare, of which you are the CEO. And that's your current venture. And can you describe this for us?
That's correct. Years ago, after leaving Meadville Medical Center, I had the opportunity to work for Highmark Blue Cross Blue Shield's Allegheny Health Network as their Chief Population Health Officer. And I had the opportunity to do some consulting at that time. That progressively evolved over the years. And right now I'm serving as the Chief Population Health and Quality Officer for the Inland Empire Foundation for Medical Care in Southern California. And it's really, in many ways, a combination of my work. It's what I love to do. And the focus is rather unique. It's about working with health plans, hospitals, and physicians, and teaching them how to better take care of patients and how to reach out to the less fortunate and ensure that we're providing the best care possible.
So you're holding a couple of positions besides the one you have now. One involves a major music company. Can we talk about that for just a couple of minutes, please?
Certainly, and this has been going on for almost 2 decades. I have the privilege of serving as the CEO and chairman of the board of the Yamaha Music and Wellness Institute. And our focus over the years has been on research and education, and we've been extraordinarily privileged to basically create a number of research studies and have them published in peer-reviewed scientific publications over the years. Our focus in that regard has really been looking at creative musical expression in terms of psychosocial, biological, and even genomic changes. So it's been a fascinating journey as well.
I always thought that you were decades ahead of your time because you read about these things today, and I'm not up on the medical journals as you are. And I do see a lot of the quotation pop medical culture, but I do read a lot about serious things, and you are always at the cutting edge. What prompts you to think about these things? Is it your work, the people that you are associated with? How do these things come to you? How do you direct your ambition?
Well, I don't know that it's so much ambition. It is, however, a sense of trying to understand the challenges that we face as a society and working with others to develop meaningful solutions to improve quality of life. And I've been very fortunate over the years to have been able to complete a number of fascinating projects. But I want you to know, Tom, when I speak in front of audiences, I basically introduce myself as the world's leading expert of what does not work.
Well,
And I think
I'm going
part
to
of the
challenge you
success,
on. I'm going to challenge you on that.
well, you can, because part of the success is starting out with all the information you possibly have, developing a hypothesis, and carrying through with it, only to discover what you thought you knew is not enough to actually make it work. So I've learned so much through numerous failures that have turned into immense successes. I have an opportunity now to run the first population health fellowship in the United States. I work with young physicians who have just completed their residencies, and they spend a year with me learning population health. Mm. And one of the most important things that I have to share with them or teach is perseverance. And that's something that I think is the difference in many ways between failure and success.
You've gone from a tremendous medical career to a motivational career, if I could say. And you beat me to my next question, that is about the Population Health Management Academy. Subsequent, or rather alongside of that, you were the former Chief Population Health Officer, Senior Vice President for Highmark Blue Cross and Blue Shield, Allegheny Health Network, a name that everyone in this community and all over the East Coast knows. What did you do for them? What was your motivation there?
Well, I had the fortunate opportunity for working for one of the best healthcare leaders in my career, a person that I knew and respected, John Paul. And we basically focused on improving the health of populations in Pittsburgh at a time that was extraordinarily challenging given the conflict between the two major payers. I learned a lot during that work with Allegheny Health Network, and I gained significant insight into what really needed to change in order to improve quality of medical care for the underserved population. And that's basically what I focus on today. And I can tell you that it's absolutely wonderful to be able to focus efforts on taking care of patients who in many cases are unable to fend for themselves.
Now I'm going to ask a couple of questions that I discerned from I'm going to unabashedly say, yes, I did look at your outline on LinkedIn. The resume is extraordinary. I can understand why people from hospitals from across 13 states have come to talk with you, or you with them. And population healthcare, can you describe that definition? And why is, sort of a silly question, why is it important today?
Well, I'll tell you, that's a fascinating question, and it really is at the crux of where our healthcare crisis is right now. Years ago, when I graduated from medical school and went into practice as a neurologist, my goal was to give all of my patients the best care that I possibly could. And I thought I was doing a good job. So if you came to me with a healthcare challenge, I gave you 125%. However, later, we started to realize that the patients who really need the help the most don't show up. And when you start to look at health inequities and underserved populations, it becomes readily apparent that many of the people with the greatest need, in fact, a significant portion of the top 5% of individuals with the highest healthcare expenditures, don't come in for medical care until it's way too late. So my philosophical framework has changed considerably with the development of this population health initiative, which really focuses on improving the health of communities. So what we really espouse is the fact that a doctor just cannot be relied upon by the patients who care to show up at his or her doorstep. Instead, as a healthcare entity, we have to reach out and work with those individuals who are less fortunate and who don't typically show up. And the health of communities is really what can propel our healthcare system out of the extraordinary mess it's in right now, both in terms of cost and, unfortunately, quality.
Well, let's bring up a recent memory. This got me going relative to asking pertinent questions of the medical industry. Obviously, the last couple of years, the COVID issue cropped up. What was could you give us what your snapshot of that whole COVID pandemic was all about?
Well, I don't mean to insult anyone, but I think it was the perfect example of government interference.
I think many people would agree. I didn't mean to interrupt you, but go ahead.
And I personally believe that throughout my career, I personally and the institutions that I've worked with have always relied on sound science, not politics, to guide our interventions. I personally believe that too many people died, that we were unfortunately not prepared, that talented, bright, committed physicians who were in public health positions throughout the United States were overruled in their decision-making by community boards that had little or no knowledge of healthcare. And I think it went from that level all the way up to the federal level in that we made a lot of mistakes.
I think back to my family who were alive generationally in 1918, and I saw a lot of parallels. Unfortunately, back then, the medical care and the war going on spread that disease all across the world and killed millions. Would you say that the vaccines and the medical care we did deliver was helpful, or should we have just let this alone?
Well, I'll be very frank with you that, and you probably know that my background is also focused on genomics research. Mm-hmm. And there was a time where I believed that sequencing the human genome was the greatest achievement in the history of healthcare. Mm-hmm. And I've later come to believe that being able to manufacture effective vaccines was probably more important. But I also learned and discovered that despite scientific advances, if the public perception was not aligned, the benefits of these vaccines did not impact the population the way they possibly could have. I'm one of those people that was fascinated with the fact that the vaccines could be so effective and produced so quickly, and yet there was a tremendous amount of negative sentiment, not only about the vaccines, but also on personal protective equipment like masks. Mm-hmm. And, as you probably know, I travel a great deal. Mm-hmm. I go back and forth between my home in South Carolina and California every month. And during the entire pandemic, I was one of those few people who wore a mask the entire time, mm-hmm. and also received all the boosters. So I think we live in an age where we're learning a lot. I think science has advanced beyond my expectations, but human behavior, unfortunately, can adversely impact the role of science in these types of challenges. I'm also frankly worried with the current state of affairs that there's recently been defunding for the prevention strategies that we need to focus on with COVID, as I fear this might have only been a dress rehearsal. Mm-hmm.
Mm-hmm. It does cause fear, and I think you answered most of what the next question was going to be is, how do you view healthcare in America or the world today? It's a challenge. What can we do better?
Well, I think that we have to look at it comparatively. Mm. Without hesitation, we spend the largest percentage of our GDP on healthcare, and yet are ranked 35th or 36th in terms of quality. When you look at us compared to the OECD nations, and you look at what we do, we spend approximately $4.5 trillion a year on healthcare in America. And when you look at that total spend, experts believe that one-third of that $4.4 trillion is absolutely wasted. Mm-hmm. And the way we describe waste is things we do that do not positively impact the health and well-being of the people we're privileged to serve. So when I look at the escalating cost of healthcare, when I look at the disparities and the inequities, especially for low-income individuals, and when we consider what other countries have been able to accomplish, I think America has fallen way behind. I'm sure there are a number of people that would disagree with me. I think that if we need a surgical procedure, America's a great place to get that type of care. But in the construct of taking care of people with chronic ongoing conditions, I don't think we're really cutting it.
Having worked in the corporate insurance field, healthcare, health insurance particularly, both on the work and the public side, I see what you're saying. How do we go about fixing this? Is there a way to do it?
Yep, and I think I'm going to be real controversial for your audience as well. The difference in most countries that have high-ranking, high-quality, low-cost healthcare is there isn't a profit motive. Mm-hmm. And it's easy to say that that statement brands me as a socialist. However, I believe that everybody's entitled to health care. I am particularly fond of the fact that we have sewers. Mm-hmm. I like garbage collection. I like fire departments and police departments that are there to help each and every citizen. And in the same vein, I think we all need health care. I think we should be in a position in this country where everybody is covered. But I want to share an insight that you probably don't hear often. Insurance is only the beginning. If people are not in some way inspired or incentivized to take better care of themselves, the cost of healthcare and the poor outcomes will continue to rise. And there have been experiments where people have been given insurance, Medicaid, through a lottery system, and the data has been tracked over the course of 5 years, and there are no improvements of health outcomes just by having insurance. So coverage alone is not enough. We need a unified strategy to be able to focus on patient outcomes, improved patient and family experiences, and lower cost. And I can tell you the result is not only a healthcare system that's not working, but it's also the fact that we have exorbitant rates of physician burnout. And when you start to look at the data, especially during the COVID period, but this extends way before and substantially after, it's not unusual to see more than 50% of physicians with symptoms of burnout. So that's a sad state of affairs for a country that spends more than any other country per capita on healthcare.
And then you go back and think, going back to your med school days, how many individuals didn't cut it, didn't get to be doctors. They just didn't cross the threshold to go on. And now the ones that did, half are not around to help us. What's the solution to all this? Do you have any opinion on that?
Yes, in fact, that's where I spend most of my time and my work.
Yes.
I believe that we need consistency within the policies of how we treat people. Meaning that whether you have private insurance, Medicare, or Medicaid, We should have the same number of quality measures. We should have the same types of strategies in play to make it easier for physicians. And we should have incentives for patients to receive better care. Essentially, people think that what I'm talking about is the single payer system, and it isn't necessarily the case. If you look at the global budget payment system in the state of Maryland, they basically brought all their payers together. They've aligned on the quality measures and outcomes, and they've augmented and improved the level of health care while substantially reducing the overall cost. It's time we came together and worked together, realized that we have to unite in our approach, and that we really have to empower physicians and healthcare systems to do the right things for the right reasons.
Let's go back to your mind-body wellness philosophy. You've done some very interesting things. A recent study on gospel music, a catalyst for retention, engagement, and positive health outcomes for African Americans in a cardiovascular prevention and treatment program. Big, long sentence, but what a wonderful concept. Could you talk about that for a bit?
Sure, and I think this is an example of a population health initiative, even though it's focused on music. The bottom line is the incidence of cardiovascular disease, hypertension, and cardiac deaths in the African American population is much higher than it is for Caucasians. And unfortunately, many individuals who are African American don't seek help in the traditional places where others do, meaning they're not so inclined to go to clinics or prevention programs or receive treatments in those kinds of places. So the idea of providing care where they feel most comfortable is really what surfaced. So essentially, I fell into a failed project. I was invited by the Rodman Street Mission Baptist Church in Pittsburgh to take a look at a study that they were doing. And the idea was they put together some health coaches. And as you know, I developed that program in Meadville. But they put together some health coaches in the church to try to focus on preventive techniques for individuals with high cardiovascular risk factors, meaning risk of heart attacks and strokes. Unfortunately, it fizzled out after a matter of 3 to 4 months. So people didn't show up. And as you know from that old Woody Allen statement, 80% of success is showing up. So they contacted me when I was at AHN, and they said, do you have any ideas for how we could improve the program? And as you probably know, I've published numerous studies over the years on what we call recreational music making. And what differentiates that from traditional music making is the fact that people come together without prior experience, and they get to express themselves in a non-threatening way as a group. And the beauty is they're not pressured, they're doing it for enjoyment, and at the same time, they receive the nurturing support, camaraderie that the group provides. So my hypothesis was really simple. I said, why don't we, for the first time in the country, take this cardiovascular education process and tie it to a gospel music program. So what we did is half the people continued or began just the cardiovascular education portion, and the other half did the cardiovascular education with nurses from the church, but they also did a weekly gospel music program, which was led by some phenomenal facilitators, one of whom is actually working with me now and basically sharing this information with other churches throughout the country. So what we did is we didn't track 2 or 3 weeks or even 3 months. We tracked an entire year of participation, which is really unusual for any program. Anybody can make changes for 3 or 4 months, but sustaining those changes is difficult. And what we were able to show was statistically significant improvements in attendance, in participation, in blood pressure. I can go on, but the bottom line is that the music-making activity, focusing on gospel music, served as the catalyst to keep people engaged and improve the quality of their lives from a cardiovascular perspective.
With everything you've accomplished to date, do you have a project in mind coming up? Something different?
I have, my latest project is an IRB, Institutional Review Board approved program that we're starting in September. It's a rather interesting program. It's, again, focused on music. And what's interesting about this study is we're looking at kids who are either developmentally delayed or handicapped who are in school. And one of the goals of education that I strongly support is integrating these students whenever possible into activities with other students, rather than taking them out of the class and treating them separately. So we have multiple schools throughout the country that have agreed to participate in a program where we basically use special education teachers to evaluate the progress of these kids and their mentors, who are students who do not face these challenges in the schools. The uniqueness of this project is the music participation is not through a special program. It's actually through the school orchestras. So can we integrate these kids, and can we utilize those adept, phenomenal kids that excel in music to be able to help these children improve the quality of their life through music? So it's basically 2 bangs for the buck. Yeah. The first is the child with the handicap or the challenge has an opportunity to improve. And second, the student who is adept at music and who is participating in the orchestra has an opportunity to develop leadership qualities by helping these kids. So again, it comes back to my sense of community, where I believe the solutions are people helping people.
Dr. Barry Bittman, CEO of the Institute for Innovative Healthcare. Thank you so much for taking a half hour of your time, your busy time, and all the projects you work on to talk with us today. If someone wanted to email you a question or send you a question, or maybe volunteer to participate, or maybe just a good doctor somewhere else wanting to share some ideas with you, what's the best way to find you?
Well, the website's Institute for Innovative Healthcare, you can look that up on Google, or you can go to yamahainstitute.org, or you can even email me directly. It's really simple, Barry Bittman at mac.com.
Dr. Bittman, good to talk to you. 20 years is way too long to wait, so I may bother you sooner than that in the future. Really grateful that you could be on the air today. Thank you very much.
This was anything but bother. You have always been one of my favorite people. The Erie community is especially benefited by your dedicated commitment and your expertise throughout the year. And it has been nothing less than a pleasure to connect with you again.